And so working through that with a relationship was always the fun and exciting part. And the biggest thing is just always learning. We pick up tricks, talking to you guys. Kind of, I agree. You're going to learn something, taking tidbits out of everybody you talk to, because at the end of the day, even though everybody has, kids with some kind of medical issue, they're all different. Colton had a liver transplant, but he also had hepatic pulmonary syndrome. But at the same point was a hypertensive. And so everybody we've talked to, everybody's had something a little bit different. And so it's not like cookie cutter where you can just read an article about, okay, this is how we do it. If a kid has the chicken pox, you treat him for the chicken pox. And this, unfortunately, has been kind of learned as we go. So the biggest thing is just learn every day.
Thank you both for your feedback. And now I want to ask that question to Ms. Angela Saunders. How has your child's illness affected you as a parent?
Okay. Can you hear me?
Yes.
Okay, great. All right. Well, for my family, Jake was the youngest of 3 boys. So we went into the hospital, have this healthy baby boy, just like the other 2 were. And at 3 days old, he had a seizure. And I had him in Ohio. They had to fly him to U of M. So that was a good hour away from here. And my older boys were 7 and 9 at the time. So they were at school, and they came home and mom and dad were gone and their brother was in the hospital. And so that was really hard for the boys. We talked about it earlier about strong marriages. We have a very strong marriage, my husband and I think we got stronger through this. But I always worried about the older boys and how much we missed out on their childhood because we were at the hospital with Jake. And Jake, sometimes before the transplant, would be in the hospital maybe 150, 175 days a year. And so that's where I would be with him. Shortly after we found out what his disease was and we knew how to treat it at home, my husband and I decided that he would pick up the slack and work 2 jobs so that I could quit my job as a nurse so that I could be Jake's nurse full time. So I did have that opportunity to be home with all 3 boys every day. Again, though, a lot of time I was at the hospital. So at 4 years old then, so Jake was sick since 3 days old. And finally at 4 years old, his liver was completely failing. He had a seizure and went into a coma. And we put him on the list then, and they kept him on life support. And oh gosh, I'm so sorry. I don't know. I didn't mean to get emotional.
Take your time. Take your time. It's okay. Take your time.
Okay. I'm sorry. Okay. So at 4 years old, Jake had his transplant. They kept him alive, obviously, for 63 days before we got the transplant. And the good thing was Jake doesn't know anything different. Jake doesn't remember his life before the transplant. His memory, I kind of say it was wiped clean because when we came home, when he was really close to 5 by then, he was still in a diaper and took a bottle, and we had to teach him how to walk and how to talk again. He had been in the bed so long on dialysis that he developed scoliosis and just a deformation in his back, and he also had cerebral palsy. So that was a really painful road to recovery. And like I said, it made us all stronger. Now my boys are grown. Jake is 16. The other 2 boys are 25 and 22, and they are so compassionate and caring about him, but also just different kinds of people in general. And I think one of the parents spoke earlier about seeing people that are different. You know, we've been to places where Jake gets into a swimming pool and everybody else gets out of the pool, or people grab their kids and don't know what to think. And, you know, they're kind of pointing at Jake's Mickey button, or his incisions, or all the scars that he's covered with from dialysis. And, you know, my kids think, wow, that's no big deal. Like, that's not different for them. So I think that that helped shape the way that the two older boys look at other people and at life. And, you know, just worried about the negative effects, but I think it had a lot of positive effects on the boys. And, you know, now we're all stronger. And so Jake is now 12 years post liver transplant. And he went from spending 100 or 200 days in the hospital to he's been hospitalized twice, thinking maybe he had a port infection, which it wasn't. And so we just hang out and watch movies, and Jake gets all the attention from the nurses that he loves. And you know, life is good, and Jake's doing great. He is a huge power lifter, very, very strong. He's gotten through, you know, all the setbacks from the transplant, from the cerebral palsy, from all the other ailments that he had before the transplant. He's gotten through all this, and you know, he's just awesome. He just does all these things, and he doesn't even think there's anything different about him, or that this is unique, that he's so strong and healthy after everything he's been through, because he doesn't know any differently. So that's one of the things about Jake, and I know you guys will talk to him tomorrow, but he's so resilient because he really doesn't know anything else but that. So that's pretty much my story. Thank you.
Thank you so much for sharing that, and to every family on this panel. So now I'm gonna pass it over to my teammate Wills, who is going to ask another question on this family panel. Go ahead, Wills.
Awesome, thank you, Austin. So the question I really want to ask, I know one of the parents touched on it a little bit, but really the reaction, you know, of hearing that your child has been diagnosed with, you know, an organ failure. And so I really am interested to know kind of what everyone experienced that as a parent. I'm a patient, so I kind of have a different perspective on things, and I'm really interested to hear kind of everyone's reaction and kind of how they reacted when you hear that your child is sick. So we'll start it off with Ms. Parker, and we'll just kind of go in the same order as we did for the previous question. So Ms. Parker, take it away. Is Ms. Parker still on, or is she not?
No, I think she got kicked. So you might.
Okay. All right. So we'll go to Ms. Ramos. Ms. Ramos, take it away.
When I found out, Isaiah was in the hospital a lot when he was little. Initially, I'm a type of person, because of my attitude and my personality, it's like that thing that, you know, what I think Austin said about, or Edward, just God only gives you what you can handle. And I know he obviously made my shoulders the way he did for a reason. And when I found out, I guess like a lot of parents maybe, I just said, okay, I got this. Unfortunately, his dad, no, I can't have this, and I'm gonna go do something else. So, and even when I was working nonstop and Isaiah was in the hospital, I'd go to the hospital. When I wasn't working, then I'd go back to work, back and forth. That's what I did for a very long time. But the initial reaction, I did ask myself a lot, why us? Why us? Why us? Why us? When I never got the answer, that's when I knew God only gives you what you can handle. And then I took that and ran with it. I knew that he needed a kidney. When they asked me, I couldn't give him a kidney because I'm a diabetic myself. So then I said, I can't do that, but I'm going to do something else. So let me take my energy and start volunteering. So I've been a volunteer with Life Bank out of in the Cuyahoga County area since 2005 because I couldn't help him with a kidney, but I could help others, educating them on organ donation. So I put all my energy into that. But I asked myself so many times at first, and God never replied to me, so that I took that as a sign like, yep, he chose you to be his mother for a reason. And my youngest son told me that a long time ago too. So I just took the bull by the horns and I ran with it and I did what I had to do. I quit my job. I became a full-time mom, and that was hard because financially, how are we supposed to survive? But again, by the grace of God, we did. And my attitude is like that all the time. When Elijah was born, and he became a type 1 diabetic at the age of 8. Then he got Graves' disease at the age of 10. Then he just continuously got different diagnoses every year, and he's 21 now. By the way, Isaiah will be 34 in July. And even with the Elijah, the same thing. It's like, okay, I know you're not playing, God, because you gave me 2 of them now. So you obviously have a lot of faith in me. So I have to have faith in you that you're going to get me through this. And here we are. Thank you.
Absolutely. I love what you had to say about, the faith to get through it, and kind of taking your experience and trying to find a way to, give back and help out. So I really want to expand the conversation here to Miss Lee. Miss Lee, I would love to hear your perspective as someone who has their son on this symposium with them. I'm sure y'all have a very special connection. I would love to hear kind of your reaction was, especially from the military family aspects of things. So take it away.
Okay, I got cut off for a minute there, so I'm not quite sure the question, but it sounds like, is it my initial reaction to finding out about his kidney disease?
Yes. Yes,
okay.
ma'am.
Oh, okay. Well, we were living in Germany, and I was going for a regular checkup, and the doctors were pretty sure, that I was doing well. I was coming along fine. I was only maybe 12, 13 weeks or so along. And, but for some reason, I wanted to have an ultrasound. Well, I knew why. I wanted to have a picture. This is my last child, and I wanted a picture like I had for everybody else. I wanted the little photo of what's going on. But anyway, so I kept, kind of pressuring him a little bit to, I want to have this ultrasound. I mean, not that I thought anything was wrong. I just wanted to have my picture because I had one with my other kids. And so finally he relented and, had me to go and schedule me a ultrasound. And at that very first ultrasound, it was a very long, grueling process because they weren't sure what they were looking at, but they weren't telling me. And so the doctors, not the doctors, but the medical guys and gals come in, and then they're having other people come in and look and come in and look. And so I knew something wasn't quite right. Something was going on. So my initial reaction, I didn't find out then, but when I had to go back because they had me come back a day after the ultrasound. They had called my husband at work. And like I said, we were in Germany. So we lived like 30 minutes away from the military base in a high rise out in Germany, out on we call the economy. So he had to come and get me and then drive me all the way to another part of Germany, which it was a good little ride away. So I'm like not really sure what's going on. And then we're towing all these kids with us. And so we get to the doctor, to doctor's office. It was an Army doctor. And the first thing he asked was, how many kids do you have? And at that time I had 4 kids. And then he kind of said, well, they didn't really tell me anything was wrong. He said, well, I think you and your husband should consider terminating the pregnancy. And that was big, yeah. Like, you don't even know what to say. Like, you're right, just like that. Exactly. Just, you know, that wasn't an option. I mean, we didn't even have to discuss that. That was not even an option, you know, to terminate a pregnancy. It's like, you haven't even really told me what was going on with my baby. They really didn't know exactly what was going on with him. All they knew is they saw a large, dark mass in the middle of his abdomen, weren't sure what it was. They knew it, I don't even think they knew it was a boy, but they just knew that there was something going on and it was not good, and they couldn't tell me what it was. And let's just not even go through this process is basically, he just gave me no hope, really. And so I was dumbfounded. And at the same time, I was, I wasn't going to give up. There was no way. That was not my call. If anything was going to happen with this child, it was going to be on God and not on me, because I knew he didn't give this baby to me just to take him away. And if he did, that's still on him. But as far as I was concerned, I was going to do everything I could to fight for my baby's life. And that's what I did. So my initial reaction was, and then we're going to do whatever we got to do for this baby. And, you know, and I always say, I wish I could find that doctor right now and just show him, even with all the obstacles and all the things that Austin's been through from birth to now, you know, with 2 kidney transplants and all the stuff that he's doing, that just makes me so very proud. And, you know, the things that he's doing to impact lives and things that he's doing to encourage and inspire, my God, I wish he could see this young man now. So I don't know if that's answering the question, but there you go.
That definitely answers the question. And I know that you have a powerful story, and I really appreciate you sharing a little bit of that. I want to pass it now over to Ms. Castro, and to really hear from her about kind of what that felt like, what it was, you know, as that experience as the parent, you know, to hear that your child is dealing with this, and kind of what that was like for you. So I'll pass it over to you now.
Thank you. Well, I have to say that my story is very similar to Clarissa's story, because I found out when I was 7 months pregnant, and I went to a routine OBGYN appointment, and the doctor was doing his exam, and next thing you know, there was several doctors hovering over me, listening to my belly, and I knew at that point that there was something wrong. So shortly after that, they informed me that my baby was in distress. And mind you, I was 7 months pregnant, and the baby's heartbeat was only 60, and a normal infant's heart rate should be at least double that, if not a little bit more. So at that time, they were trying to figure out, what do we do with her? And so they were trying to medevac me to a place called Loma Linda, which is in California. And they said they wanted to send me to a hospital that specialized in infant heart issues. And so after a while, they were not able to get a helicopter. So they put me in the back of an ambulance for an hour-long ride to this hospital. At that time, of course, it was all by myself, because I was just going to a doctor appointment, then I was going to work. That never happened though, because after going to this hospital, they did this in-depth ultrasound, which they can see inside the baby and then, make some kind of conclusions. And so I was sent back that night to the hospital where I came from and spent the night there because I was devastated. I knew something was seriously wrong. And so I started going into contractions at 7 months. And the next morning, they informed me that my unborn baby was in distress and that she might require open heart surgery at the time of birth. Needless to say, first time mom, first time parents, it's devastating. So I was confined to bed rest, of course, until the time of delivery. And at the time of delivery, of course, my baby was taken from me immediately and put on a ventilator, put on a respirator, and all kinds of leads and, all kinds of tests needed to be done. My mindset was, I'm pretty much a positive person. So I kept thinking, I had a positive mental attitude. And I kept thinking, well, she's, kind of like a car. You're going to, give it to the mechanic. They're going to, fix it and then give you your car back. Well, I was kind of thinking in the same terms. Of course, that was because I was in my own head, just thinking everything's going to be okay. I just knew it. I had faith, and that's what kept me going, was that everything was going to be okay in the outcome. But on the fourth day, we were, as family, we were given the news that the doctors wanted to implant a pacemaker, and that was to buy us time because they diagnosed her with severe congenital heart disease, and she was not expected to live. Born at 4 pounds, 14 ounces, and as sick as can be. And if we don't put this pacemaker in her, we might not even get to the next day. So on day 4, we had a pacemaker implanted, and that was to give us time. We were given 3 options as a family. First one was to just take her home and let nature take its course. The second one was to put her through a corrective type of heart surgery called the Norwood procedure. And the statistics that they gave us were not all that great. And the third option was to put her on a national donor waiting list to receive a life-saving heart transplant. And that was in 1990 when she was born. And so people were not donating organs back then. So as a parent, the initial thought is it's not looking that good. But we were actually, through our hospital, given an 80% success rate on those surgeries that had taken place. So we decided to go ahead and put her on that national donor waiting list. And at 5 weeks old, my daughter became the 85th baby to receive a heart transplant under 6 months of age. And so it's been 30 years now. She's been doing really good, but it's still super emotional to this day. And to know that, she's a true miracle, and she's here because, somebody said yes to donation even way back then. Somebody who had just lost their child and said yes to donation. So we are grateful for that family every single day. And not to take up the whole panel here, but 2 years ago, she had been in kidney failure. And so we were heading towards dialysis, and that never happened because she ended up getting a kidney transplant from her baby cousin who passed away on his 4th birthday. So it's been 2 years now, but we are still grateful, and it's still hard. I think it's always going to be hard, but as a parent, I'm grateful, and you know, it is a journey, and I think we're in this family together because, you know, all of you have been through struggles yourself, and it's not easy, but I think, you know, sharing our stories and being here to support one another and to being an advocate for our kids is what we need to do, because giving up it's not an option. Thank you.
You bet. I love what you said there at the end of, you know, giving up isn't an option. You know, I think that's really awesome, and I really appreciate you providing some of that information. I want to be respectful of our time. So I'm going to hand it over to Austin here for a second. Austin, I want to see kind of where we're at and what we're looking like. So go ahead, man. What do you got?
Yeah, so we can move on to the next question on the panel, just because we want to make sure we keep them right with time on here. So let me go ahead, and this is actually a really great one. And as you all feel comfortable and want to answer, feel free. And this question can pretty much go to all the families, all the parents on the panel right now. So think about what kind of advice and encouragement that you would give to other parents who are currently going through a similar situation or will in the future. And I can ask if you want to speak on that, Ms. Saunders.
Well, my advice would be to educate yourselves. You know, us as parents are the best advocate for our children. Sometimes we get into circumstances when our kids are in the hospital that, you know, we have to be strong and we have to make informed decisions. I did a lot of research when Jake first got sick. I mean, when we first learned about his disease, and there were a lot of times that I would be in the hallway arguing with the doctors to do the right thing for Jake, to keep him alive. And, you know, nobody knows your child better than you. And so that's really, I guess, my best advice is to be strong for your child, because, well, it's your child and you know them best. And when you go in there and you're educated and you're making informed decisions and educated decisions, then I just feel like the doctors listen to you more than just an emotional parent. I think you can tell I'm kind of emotional, but back when Jake was sick, I was pretty tough to deal with. And I kind of had a reputation at the hospital, like, you know, here comes Jake's mom down the hall. So that's the best thing you can do, is do what's best for your child. And, you know, knowledge is power. And I think that's pretty much the best thing I can tell people.
Okay, thank you so much, Ms. Saunders. Appreciate it. Next, I would like to ask that same question, if you have some feedback on Mr. Tim Stotts.
Yeah, so I think a couple things are important. I think that it's important for parents to make sure they build the right communication with all their children. You know, a couple of you hit on it. You know, it's never your own. It's not your only child that has something going on. There's other kids involved, and you want everyone to feel equally appreciated And even though they're different and you may appreciate them in different ways, you want everybody to feel appreciated and loved, and you want that family to bond. And even if they bond over that, and there was a story told earlier about how the kids really rallied around their other children. But I think that the biggest thing I'd say is, as someone who is very, my wife works for the National Kidney Foundation. I've been involved with CAMP and the foundation forever. And I've had 2 transplants myself. The last one was 6 weeks ago. People kind of know I'm the kidney guy, of my friends. And it's amazing how many people I've met who are just seeking out information. From parents who are seeking it out to people seeking it out for themselves. And my advice to parents is always, I'm going to tell you what I think, but ask 50 other people. Ask everybody you can possibly ask, because I've sat on this for an hour and a half and have heard 20 different stories from 5 different people about all the different aspects going on. And there's bits and pieces of that play in. And one of the biggest bits, Mona, you just mentioned that I've had a hard time with when I had a deceased donor was, yeah, I got life, but somebody else lost life for me. That was really, really hard for me to wrap myself around. It was really, really hard. And I think as a parent, you want to be able to have those conversations with your children. You don't want that bottled up inside of them. You want to make sure they have an outlet to say how they really feel, so that however they feel can be dealt with properly and they can live as normal of a life as possible. Because a lot of those, I've said it earlier, it's the psychological stuff that's so hard to deal with because you can't see it. If your kid's sick and vomits, well, you see the vomit because, if your mom, you probably have to clean it up too. But if you can't see the psychological things, you don't know. And so you got to build that connection, and you got to make your kids tell you. And we all know, I was a teenager. It was more years ago, and I'm going to share with you. But I was a teenager, and I know how little I wanted to tell my parents. My nickname by my parents was Fine. And they would, not because I looked good, because every single question they ever asked me, I said, fine. How was school? Fine. How you doing today? Fine. There was no elaboration. I didn't have time for them. But I think building that helps, because I think that there's a lot of mental things that you sort of struggle with, and anything a parent can do to build the bond. And sometimes it's even allowing other people to talk to them that they'll tell more to, like an uncle or an aunt or a good friend that they just feel a bond with. Again, not to get Edward's head too big here, but that's a role he plays a lot with some of those kids at camp. They'll tell him things that they don't tell their mom and dad, and that he can work with them and help them get better and feel confident. That's really important. And I think sometimes as a parent, I can imagine getting so overwhelmed with all the check boxes you have on the health side that even thinking about the mental side, hell, your own mental is not always stable, much less thinking about how's your kid going to come out of this. And so my advice always to parents is simply, you're going to have a guide of some sort for all the medical things. I'm not saying it's easy, but there's a doctor, there's lots of people that are going to get involved in the medical side. There really ain't anybody there getting involved in the psychology side, the mental side of what you're about to deal with. So you better figure out how you're going to do it, and don't be afraid to do what you need to do for yourself and your child when it comes to that. Because if you don't, you're missing a really, really big part of the impact that this disease will have on you, your spouse, your family, and the child that has that particular disease. And it'll play out all the way through their lives. I'm happily married now, but I had a divorce when I was 33. Well, I'm sort of giving away how old I really am, because that was a long time ago. But anyway, and it was really funny. I was talking to this counselor after, and she made a comment to me that has stuck with me so hard. She said, Tim, it seems like that you were born with kidney disease, and because of that, you have tried to rush through everything that most people take 60, 70 years to do in like 30 years. You want to get this type of house and you want to be at this point in your job. You're rushing through life because you seem afraid that you're not going to see as much life as the next person. I mean, I think about that all the time. And so I think there's just a lot of these things that psychologically impact you that if you don't pay attention to it now in your kid, later they will have to deal with it in some way. And if you can find them a conduit to deal with it, you're doing them a tremendous, tremendous favor. So.
Okay, and unfortunately, because of the time, because I wanted to get, I'm glad we were able to hear from as many families as we were today on different family support panel questions. So we are going to close the family support panel.
Hey, also, you can
yeah, go ahead.
You can, sorry to interrupt. You can let Amber and, sorry, I forgot
Okay.
her name, and the others who only answer one question, and then we'll close it out. But yeah, but thank you all for being on. Go ahead.
Yep. So let me get that here. And now, when you guys think of the YNOTT Foundation, so how can the YNOTT Foundation better be of assistance to you and other families who may be in need of our services? And I'm gonna start with Amber.
I am really interested in the aspect to help my child like wrap his head around there's other people out there like him, just the support group, growing as a person with a disease, and just a support system for him to grow old with too. I'm really interested in the summer camp aspect. He loves to interact with kids, so anything we could do to help him understand his disease better.
Thank you so much, Amber. I appreciate that. And next, were we able to get Miss Holly back on? So I know she has. I know she has a really impactful story with her child being involved with the YNOTT Foundation. But if not, the floor is open for. Let me ask, Miss Lee, how do you feel like the YNOTT Foundation and how their services can be impactful to patients and their services going forward?
Well, since my child is grown and an actual volunteer, I like that aspect of the YNOTT, that you all are grooming. That's what I'd like to see. So I'd like to see kids being groomed to help other kids, to volunteer, to give back, that they have something that they can offer. I think that's powerful. I think it's very powerful that they can, you know, that maybe YNOTT can be an avenue for them to be groomed to impact their community, impact their, not just the kidney community, but just their community period, that they have something to offer. So, you know, mentoring, even, you know, as kids, mentoring other kids, you know, being able to share. I'm sure that they do that in camp and stuff like that, but maybe on another level. I just, you know, we're all about giving back. So I like that aspect, volunteering, giving back, helping to empower them, and being okay with that.
Thank you so much. And I want to ask the same question before we close out to Miss Angela Saunders. There you go.
Okay, I'm sorry.
No problem.
Well, I'm still learning a lot about why not myself. But I do think it's really important, like Miss Lee said, to teach these kids to give back. I think it's important for them to see that there's other kids dealing with what they're dealing with, or like I was just talking to my husband about, the other mom here, Amber, and they're kind of new. There's people in all different stages of transplants. You know, some of you are grown and you had your transplants when you were younger, and now you're giving back. And then there's some people that are new to the transplant community. And then we are like kind of in the middle, in my opinion, like we've been through it, but you know, Jake is still only 16 and he's got a lot to go through yet. So I think it's great to network with other families and other kids and get them all together and, you know, help them give back and make some learning opportunities for them and teach them. Thank you.
All right, thank you so much. And that comes to a close of our family support panel, which was wonderful. It was great getting all the feedback, and what one thing I want to say to you all is making sure that you continue to utilize the chat to connect with one another. You know, because you want to make sure that you stay in touch. You can kind of build off advice. You know, different things that you all, similar things that you all go through, you can kind of share with each other to help each other get through, you know, as family support, as it's called. And right now, Wills, did you want to add anything before we close?
No, I think we're good. Again, I appreciate all of you so much for being on this panel. It really is an honor to be able to hear from all of you and glean from your different experiences in the area of transplant. And so with that, I want to pass it back over to Austin so we can continue the rest of our symposium.
All right, thank you so much. And now it is back to our great moderator, Mr. YNOTT. Go ahead, take over.
Awesome. See, we like to pass the ball around. See, we're a team player. So, but once again, thank you all so much for being on that panel. I'm so inspired. I forgot the camera was on because a tear was coming out. Every time you see me turn the camera off, you know, I had to go get a tissue. But it was really touching stories, and thank you so much for taking time out to join in. We'll be revealing something special on tomorrow, which will be able to connect you families, patients, health physicians together. So I don't want to give out too much, but tune in tomorrow. And also we have a special panel. Please stay tuned if you can. We have a special healthcare panel coming up with a pharmacist, dentist, fitness coach, and social worker. So you do not want to miss that. And we are professionals. Like I said, we're patients turned professionals. So we had a commercial in store, but instead I would like to take, instead of the commercial, to make sure we stay on time, which we're huge advocates of. I would like to introduce this guy, been with us before day one, Mr. Nate Wilson. Let him come up and just say for about 2 minutes and just share your experience with the organization and how you've seen it go from a vision board idea to now impacting lives nationally. So, take it over.
Hello, everybody. Well, first, I just wanted to thank everybody on this call because I realized something that, yeah, I have been around for quite some time. To give you just a little brief history, Eddie and I met when we were in college, and I knew that he wanted to get a website, and I was there for a lot of the early developments of all the graphic designs and the websites and programs like that. And I just always appreciate Edward and his persistence, because after all these years, he continues to go and go. And I love to see the community that he's building and how he's impacting, you know, all of you guys working together to make this kind of impact. But I'm really touched today, especially because I've noticed that I've always been on the external side of things with YNOTT. Like, okay, what do you see? The logos, the website, all that stuff. And this was the first time I seen a lot of the internal, and hearing all of your guys' stories. I myself realize that I've taken a lot for granted, listening to all the different walks of life and the struggles that you guys have been through. And I just I appreciate everybody's vulnerability and willingness to share, because it's definitely given me some perspective that I honestly didn't have before as much. And it makes me feel that much better about kind of still being involved for all this time. And yeah, just again, thank you guys all. And I love what you're all about.
Awesome, Nate. And just 30 seconds, hold me to that or cut off my screen. But yeah, Nate, he actually created the YNOTT logo. I sat down with him right when I got sick. I had to leave Eastern Michigan University to go to University of Toledo. I sat down with him at a coffee shop, just told him that I just wanted the Lord that gave me a vision just to impact lives. He created the logo free of charge, created all this stuff to help bring the dream to fruition. And 16 years later, we got so many trademarks and copyrights. And like I said, it would not be possible without an individual like him to believe in me at such an early age. So thank you, Nate. I love you, man. Continue to do great work. And yeah. And now I have a true pleasure to introduce the last panel of day one. I would like to introduce my team member, Mr. Tafaro Cook and Mr. Philip Jones, to introduce these amazing professionals. Also, some of the professionals or one of the professionals is a transplant patient turned. I'll let her tell her story, but take it over, Mr. Cook. And thank you all for, like I said, this is going to be a special one. I'm about to get my popcorn. Take it over, Tafaro.
Phil, okay, I'll take it over. All right. So healthcare professional panel discussion. We have Dr. Richard Phillips, clinical social worker. Can you tell us something about yourself, Mr. Phillips?
Yeah, thank you guys for having me. It was Wills that kind of reached out to me about this. I teach at the University of Georgia part-time in the social work department, and for the past 13 years, I've been working in dialysis. It's been with adults, not with pediatrics, but I do think, there's still some things I guess I could share in regards to the family support and some of the things that may happen in transition.
Okay, thank you for that. I appreciate that. Now I want to hear from Arian Hamdi, the dentist. Can you tell us a little bit about yourself?
Sure. Thank you guys for having me as well. I am a dentist practicing in Maryland. I actually went to dental school with Edward's wife, and that's how I got introduced to Edward and this fantastic organization. I've been a fan of what he's been doing and his vision ever since, and I look forward to contributing tonight as well.
Thank you, sir. We appreciate having you. Also, my little nephew that I can't say, this kid is just wonderful, man. He's my little nephew. I love him to death. James Smith, fitness coach, mentee, my man. Go ahead, tell us something about yourself, James.
Thank you for that introduction. So I'm a personal trainer. I've had maybe about 8 months roughly as a personal trainer, but a lot of years of experience have been taught to me, especially by Tafaro, because he is my training coach to go to. I'm in the military. I'm currently at my base right now. I just got off work. So, I work with bodybuilding and fat loss, muscle building clients and everything. So this fitness is a lifestyle for me. So I enjoy teaching it as well.
Cool. All right, good deal. Also, Dr. Sally Tirana. I apologize for pronouncing that wrong. Can you tell us a little bit about yourself?
It's okay. Thank you. Thank you so much for inviting me.
Yeah.
I'm really glad to be here tonight. I am, well, a Marylander. I've been here for a while now, and 21-year kidney disease patient turned pharmacist in the last 6 years. I received my first transplant at 15 that lasted 15 years. And then 6 months ago, in about a week, I'll be 6 months post transplant for my second transplant in about a week. And so I'm a clinical pharmacist that specializes in medication management. And all that is just a fancy term for working with people that have chronic illnesses and helping them figure out ways to remove any barriers in their way to staying and being compliant with their medication. That ranges from cost assistance to access with transportation, or if people are making decisions about whether to buy food or buy medication, if parents are having to miss work. And so I work a lot with social workers and navigators and things like that, but that's pretty much what I do.
Great to have you, and we appreciate you, and I'm glad you're doing well with the second transplant. That's pretty awesome.
Thank you.
Philip, I'm gonna let you take over and go ahead and ask the questions.
All right, thank you, Mr. Cook. I appreciate you. Mr. Smith, I have a question for you. What exercises would you recommend that a transplant patient do at home? I guess starting from when they get like an okay from a physician to start being able to not necessarily just like lift weights, but push-ups, sit-ups, anything like that in that realm, because as transplant patients, we have to kind of take it easy in the beginning of our stages of working out. So how would you be able to advise whether it's a kid or or like you said, these things that pediatric and adults in this situation I think would be the same, but how would you advise that to happen schedule wise?
Absolutely. So honestly, I would start off by stretching. Honestly, with everything with stretching, you can never be too flexible. And one of the things that you want to make sure is that your joints and your ligaments are always staying up to par. I would also throw in simple things like air squats, push-ups, sit-ups, even anything with resistance bands. Honestly, I am a firm believer that resistance bands can do just as much as weights can do. And if you feel like you need something to just place in your hand, I would get the lightest weight that you can find, even if it was a 1 pound or 2 pound dumbbell. It could definitely be the difference, because some people definitely need things in their hands as they're working out to feel like they're actually doing things.
Great, awesome. I appreciate your answer. Mr. Cook, you have the next question.
Okay, this is for this is for the social worker. To you, how important is the support family?
So family is definitely critical. I was a fly on the wall for part of the previous panel, and it was evident even in some of the stories that I was privileged to get to hear, that the family role, it was coming out in those stories. So when someone is impacted with a chronic illness, like dialysis, for example, it impacts the whole family. It's not just that individual. So now you're looking at additional appointments. You're looking at additional draws on resources. Someone in the previous panel mentioned having machines in one of the child's rooms and having siblings in that room as well. So, one of the biggest things that children need is to be seen, heard, to feel safe, and to feel loved. And I think when those pieces are there, then the family support has to fall in around that. And that involves sometimes changes in cooking. If you're on a dialysis diet, that means that now whoever's responsible for meal preps is needing to do either meals for everybody that may not want that diet, or they're having to cook 2 different meals. And again, the draw on resources can be extremely demanding with something like dialysis. So having that support to get to those appointments, to help navigate the healthcare field, and likewise, it came up in a previous panel, to help navigate them finding a peer, someone that they can connect with that has some understanding or some frame of reference for what they're going through. Like, again, the gentleman in the previous panel mentioned having a fistula, and how, you know, when you're young, just even having a zit on your nose might be real, something you're real self-conscious about. So the idea of having a perm cath, having a fistula, having a PICC line, something along those lines, you know, can be a barrier to social engagement. So having that aid and support in navigating the healthcare system and navigating a way to get to peers or to get to networks like this, I think is really critical. There's a big demand on the family unit when these things happen, even down to loss of relationships. So that piece of family support, it takes supporting the individual with a chronic illness, but also kind of a networking and support within the family, because if not everybody's in the game, so to speak, then that creates extra challenges. And if somebody chooses to leave, so to speak, then you are leaving one caregiver with the total burden. So family support is absolutely critical in being successful in positive health outcomes.
Yeah, that's big, because I remember, you know, one thing that helped me a lot was being a trainer. So I understood about nutrition. So I had to watch my phosphorus. I had to watch the calcium and the potassium I take, and I had to make my own meals, you know. And so, and coming from the support part, you know, just like Austin, I was 5 kids and I was the youngest out of 5. So, you know, one thing I love about, you know, we talking about the support system was, even when I was in the hospital, I always had a sister or a brother, either a mom and dad coming to, you know, give me support. And with that, you know, having that big family, and that was great, man, because it kept me wanting to go too. And I've seen, you know, working with thousands of patients over the years, I've seen where kids didn't have that support. So I try to make an effort to go see them more often, you know, just people and stuff. Go see them while they're on dialysis. Go see them while they're in the hospital, because it gives you a will to live, to see somebody caring for you. So that support is big, man. Yeah, that's really good. Go ahead, Philip, with the next question, please.
Okay. Sally, so question for you. What can parents do to, I guess you could say, minimize the cost of medication? So exactly what do they need to look for when it comes to certain medications that cost maybe too much for their budget or anything like that? Because I know that there's a specific medication and then there's a generic kind. So what they need to specifically talk to their physician, the pharmacist, like how would they get that information to be able to assist them?
Yeah, that's such a great question. So I think as far as anybody who's going through any type of chronic disease, they have to really, really spend time and energy to try to understand what their insurance provides and what their insurance covers and what their insurance doesn't cover. The current health system in this country, we don't necessarily have a good way or good system of helping patients get easily access that type of information so that they are empowered and engaged in the decision making of what medications could potentially work for them. And so I always think that one of the first resources has to be the pharmacist that they're working with. Your community pharmacist is aware of a lot of resources, but there is a website that we essentially go to try to look for what type of assistance are available out there that patients can apply for at no cost to them, like absolutely zero. They even have a disclaimer on the application that if someone asks you to pay them to apply for assistance, you shouldn't use their help. And the website essentially is called needymeds.com. And that is the primary resource that a lot of pharmacists use around the country to help their patients be able to gain access to medications. You alluded to the fact that there are brand and there are generic. Essentially, before a medication can be approved to be on the market and available for your doctor to prescribe it, it goes through a series of evidence-based review that they have to provide a lot of data to the FDA. And a lot of that data, first and foremost, they have to prove or establish that the medication is able to do what the company claims that it's going to do. And so if you are a drug that is first to the race and get approved, they essentially can give you anywhere between 12 or 18 years of being the person that exclusively makes that drug, right? Capitalism. So until another company comes along or until that patent period expires, that company is the only one that can exclusively make that drug. So usually what ends up happening is that when a generic drug hits the market, the price of the brand medication decreases exponentially. Like it could become up to 80% cheaper than what it was the year before. And so what I tend to do is, or what your pharmacists will do is they keep up with the patents and they keep up with whether or not there are any new drugs in the pipeline that are coming to the market if cost is a barrier for you. Because the moment that takes place and there's a generic on the market, the pharmacist is able to either contact your doctor and ask your doctor to switch it, or the drug company suddenly cuts the price and a medication that was not covered by your insurance the previous year is all of a sudden covered at this time. And so I think as far as resources go, you should ask the dialysis center or the transplant center. Many transplant centers around the country now have a pharmacist that's on their service. Ask for a consult with the pharmacist and be transparent with them about the fact that cost is a real concern for you, because you could do the research yourself because the website is essentially available to anybody. But talking to a pharmacist, like that's their job. Their job is not just to make sure you take the medication, but to also help you find those assistance programs that exist out there where some drug companies can ship you a drug for up to 2 years and you don't have to pay at all for it. But I don't think a lot of patients know that these things exist and they're completely free for them to apply.
Thank you for that. Yeah, that's big, man.
Yeah, we definitely appreciate all the information you just gave to parents and us, period. You know, to be able to know these things when we go and speak to these kids as well and their parents. Ms. Cook, you got the next question.
Yeah, but to chime in on what she said, man, that is so important. Where a lot of people, I've been in dialysis centers talking to people about transplant, and they're fearful for getting a transplant, all because they don't know how they're going to pay for their medications. And you know, so people like a lot of times they like to stay in a bad place because that's the place they know, and they're afraid of the unknown. So they put these barriers up. I'm gonna get my medication. I don't know if I can, you know, they're comfortable with being bad where they are, but they won't get good. So that's a great information. I'll pass that information on. This goes to the dentist, Dr. Arian Hamdi, the dentist. This is a question for him. How can patients' immune impressed status affect the outcome of their treatment as far as them taking the immune impressed medications?
Yeah, so I would say an immunosuppressed patient definitely could be affected by treatment. And a lot of it depends on the type of treatment that we're doing. Certainly if it's a more invasive procedure, an extraction or such, then it's definitely something that we want to take precautions to minimize the chance of postoperative infection, to minimize the chances of delayed healing. And it's something that we would definitely want to bring in. I personally would want to consult with some of their other physicians and people that are responsible for their care. So we would talk to their say their nephrologist, their pharmacist, like our fellow panelists. We would kind of see what the best way is to manage this, and even at times possibly look at alternative treatments that may have a more successful outcome given the medical history that's involved. So there's a lot to kind of be mindful of going in, and it's a decision that I think needs to be made, not just by myself, but alongside the fellow specialists, and of course with the immunocompromised patient in mind as well.
Yeah, that's big right there, because a lot of times people don't understand that you have to get your teeth together before you get any transplant. That could be a roadblock also. So
yeah,
go ahead, Philip. I'm sorry. Go ahead, doctor. I'm sorry.
Oh no, I was just gonna say you're absolutely right, and that it's important. There's a big connection between oral health and systemic health, and that needs to be addressed. I'm getting, maybe once or twice a month, we get clearance letters for patients preparing to undergo different types of procedures to make sure that everything's healthy from an oral health perspective, and kind of getting it to where they're going to have the best chance of healing after any transplant procedures or such.
Right. Awesome. Thank you. Go ahead, Philip. I'm sorry.
All right. We got a list of questions here. I'm gonna jump over some of them, and so we can speak to everybody individually. Mr. Cook, if you're all right with that.
Yeah.
This question is for Dr. Phillips. What are some of the challenges you see in the transitioning from pediatric to adult care, and what would your advice be to those patients to overcome those challenges?
All right, so I haven't had the opportunity to work with a pediatric population. I have been in dialysis long enough to see a handful of people come over from pediatric to the adult population at 18. And I've also interacted with a fair amount of individuals who maybe were not on dialysis at an early age, but had other medical or chronic conditions that they were juggling and dealing with leading up to dialysis, maybe at a later age. So one of the things that I've noticed is that it seems as if sometimes the children and adolescents that have dealt with medical appointments, medical needs, being told what medicines to take, what regimens to do, that over time, a lot of them seem to get desensitized to that. So by the time they get to us in the adult population, sometimes those are the ones that are struggling with compliance, struggling with coming to their appointments, staying for the full amount of time, taking the medications, because it's been so much of their life. They've had to do it so much. It's either a combination of being desensitized or burned out. So I see some of that happening. So I think if there's a way to help the child and adolescents hold true to the treatment and the regimen, and not be desensitized to just having so many medical things and so many medical appointments, that there's almost a loss of a connection with how serious some of that is, and how serious some of their day in and day out choices can be on those outcomes. I think the other challenge is you're talking about a developmental age when people are trying to establish their identity. Well, they've almost been given an identity of having this chronic illness, or having to do dialysis, or being a transplant patient. And along with that, they're losing some independence, which doesn't normally happen to us until we get closer to retirement age. This is the time when they're trying to explore independence, and they're losing, and they've lost some of that. So some of that is creating these challenges as they move in. We know that anxiety and depression are the two main causes that people seek out counseling and therapy. And we see anxiety and depression quite frequently in the dialysis centers as well. And again, having to navigate and adjust to chronic illness at an early age, some of these individuals have faced their mortality at early ages, and some of them more than once. So that transition from childhood to adult, really, those are the only pieces I can can speak to, as I see kind of how they come in at times from that, and that appears to be what I'm seeing. So I think, again, keeping them connected to the importance of the day-to-day choices they make and their health outcomes, even if they're tired of that, I think it can be really, really important. So that kind of that sense of identity, some sense of independence, even though they're still bound to some medical appointments, and being able to still stay engaged with treatment, even if they're fed up with it, basically.
Yeah,
Great.
that's big.
Appreciate that.
Go ahead. I'm sorry. So,
Oh no, I was just thanking him for his answer. Mr. Cook, you can go ahead, go.
yeah, I just want to say that's very, very important, Dr. Phillips, because Eddie and I have worked with kids, you know, that we've seen kids start in their, you know, in their young teens, and then all of a sudden, you know, about to go to college, and you know, they're going to camps, and we see these kids pretty often. And then what we do, we always tell them, you know, especially myself, hey, you're going to be an adult now. I need you to start being responsible for your own medications, you know, going to your own doctor's appointments, all these things. And I even tell parents that, you know, still give little Johnny, he went through his challenges with a transplant stuff, but still make him, you know, take out the trash, still make him do work and everything, because this is just one part of his life. We want him to be a successful adult too. So, you know, you still have to, I see a lot of times where the parents baby him all the time, like, oh, he's sick. No, you still got to make him, you know, be a citizen, you know, and make him still do work and everything. That's why, you know, when I hear some of the kids, you know, go to college after going through all these transplants and all these episodes of health challenges, that's a wonderful thing. I love it. You know, even after I went back to college and graduated, going through a decade of a dialysis. So that's really, really important, that keep on going with your life. You know, you're going to transition to adulthood, but you have to be responsible now. You can't go out here drinking and stuff because you see your friends in college and doing those things and doing all that kind of stuff. You have to keep your medications compliant. You have to keep compliant, going to your treatments and everything, because you're responsible for you now. So I love that answer, Dr. Phillips. That was really important. This goes up to James, the fitness trainer. What can patients do to maintain a healthy lifestyle post-transplant? That's after they get their transplant. What can they do to maintain a healthy lifestyle, James?
Other than the fitness side of things, I think the nutrition part is probably the most important thing, honestly. That and the mental health aspect. One thing that I have noticed is that if you let your mind control your body, it can deteriorate. And it's unfortunate that has to happen for you to realize, like, okay, maybe I'm not okay. But I think it's important for your nutrition and your mental health to be on point, because that's the only way we're going to want to get through the day and want to actually, you know, get through this traumatizing part of your life where you just came out of surgery. Your lifestyle has changed significantly. You may not even be able to do some of the things you were doing before. It's important to understand those things, accept it for what it is, and then continue to move on every day.
That's big, man. Yeah, because you know, that's funny. You know, I would see, you know, like just like right now, you know, I work out and everything, and I have friends that take protein and stuff, but I can't take protein, you know, because of my transplant. I can't take supplements like that. So, you know, but I've seen people who have transplants and take that stuff, and I'm like, hey, man, you know, you can't do those things. So nutrition is big, man. Nutrition is life. You know, it's preventable. You know, it prevents a lot of things in the first place. So that's big. Go ahead, Philip.
Yeah, no, I'm just gonna elaborate a little bit on what you guys were just talking about. The nutrition thing is really big because, and I'm grateful that you know, even though my parents were divorced, they still instilled in me how to take care of myself. You know, cooking, you know, and anything in that area. So, I mean, I've been, you know, pretty much in the kitchen since I was about 7 or 8 years old. So, when it had to make that transition for me, it was easy, you know, a little easier for me. You know, I know some kids will make it a little bit harder because they used to eating chili cheese fries, chili dogs and hamburgers and, consistently all the time. And I'm not saying I don't. I'm not, I can say I'm perfect, but I have the ability to just say, you know what, I'm tired of eating that right now. I'm gonna go in the kitchen, maybe a salad, or maybe a grilled chicken sandwich or something like that. So I think that's for the parent. Even if I'm not saying that you have to necessarily cook for your kid, but just get them in the kitchen to want to do it. Because if you have them in there and at least have it a feeling of wanting to do it, they're more inclined to actually do it than just get up and go get something to eat, from down the street, Taco Bell, Burger King, or whatever. So, definitely, I wanted to say this earlier. I appreciate all the parents that are on, today, family support that are here, and for not giving up on yourself, not giving up on your kids, not giving up on God, and being able to get your children and yourself through the situation that you all are going through. It's not just us as patients. It's not just you as parents. This is a family situation. And so, me, like I said, I've been dealing with since I was 4. So, I definitely understand the impact that you all make on your kids' lives. So thank you. The next question is for Dr. Hamdi. Is why is it that pre-transplant patients have to get their dental work updated prior to receiving a transplant?
Yeah, so I think the big factor in that is the connection again between oral health and systemic health. There's been studies that have shown bacteria that we find exclusively in the mouth has been found in other parts of the body. And so in order to avoid any potential complications from, say, the transplant, or any potential, immediately following the procedure, such as a transplant, you don't want to have to, get up and go to a dental appointment due to dental pain. So minimizing the chance that there's anything that has potential to cause you pain on the dental side, and then providing at least a healthy environment on our end so that we're not giving any chance of anything compromising the success or the outcome of the transplant. So, that combined with the fact that, like I said, the minimizing the chance that they're going to have to be inconvenienced by this procedure while they're recovering from their transplant, we'll do our best to kind of get everything healthy on that front prior to that appointment.
Awesome.
Yeah, that. Go ahead. I'm sorry, Phil.
No, go ahead. You give them a scoop.
That's big, Dr. Hamdi, because like I said, again, people, you can't even get any type of transplant if you don't get your dental work taken care of. And like I said, a lot of times people use that as a roadblock. I didn't know I had to go to the dentist. Well, yeah, you got to get that, get your oral mouth fixed because of systemic health. And that's big, and that's very, very important. Even it's big. Every time I go to the dentist, I have to take antibiotics before I can even go to the dentist. I take these pills and stuff like that. And talking about, medication, I want to talk to Sally right now. This question is for her. Is with you now being a transplant recipient, and I know you was, how does it feel to prescribe some of the medications that you take now to people? How's that work out?
A lot of what I do is making sure that I focus all of my energy on, this is what the medication is, this is what you're taking it for, and this is what you can expect. And there have been a lot of studies that have been published that show that when people are prepared mentally for what the negative outcome of medication is, they're more likely to stick with it, right? So if you tell them this could make you nauseous, this could make you go to the bathroom and pee more than 6-7 times a night, when it starts to happen, they're less anxious about it and they're more likely to stick with it and continue. So a lot of my energy goes into that, but it's a completely different experience. Like when I was put on prednisone right after transplant, and it's 2 o'clock in the morning. I want to dust. I want to vacuum. I want to go for a walk. Like, I just couldn't sit down. My hands are trembling. I can't, like, my mind was just racing. I want to do so much. And in my mind, I know it's the prednisone or the fact that all I wanted to eat was pancake and all I wanted to drink was orange juice. Like, I wanted chocolate. Like, it's all these things that I haven't had in over 2 years, and all my taste buds wanted were these. And so it's very different because mentally I'm aware of it, but the self-control aspect of it, and I'm like, oh, that's just my steroids, or I'm quick-tempered, like I'm on a lot of steroid, I know, or I would apologize to my husband a lot because I was just super short fused. And thank God he's a pharmacist, so he could recognize that some of the things that was going on were also medication induced. But I really focus on making sure that folks are mentally prepared for what it's going to mean when you start taking the medication, and really making sure that, especially my post-transplant, I ironically have a lot of post-liver transplant patients. It's the same routine. And so I make sure that they understand the role of the liver and how many medications go through the liver, and making sure that, like, I don't care if it's labeled natural or herbal or from the earth and of the earth, like, don't put anything in your body that you haven't talked to me or your doctor about first, because we can do the research even if we don't know what the product is and tell you, okay, based on your medications, maybe you can separate it. Maybe you can take it 6 hours after you take your morning meds. But you're not going to know that. You're just going to lump it with all your other pills. And next thing you know, you're in the ER because you're rejecting from something you've been exposing yourself through. But yeah, the experience is the same. As a patient, I have my frustrating days. James was saying, where the mental and the physical, that's been challenging, just trying to get the two to align, and not feeling overly guilty. It was a deceased donor. So I have been struggling with some of the mental aspects of it, but at the end of the day, I do let my team take care of me. I'm the patient at that point in time. I try to reserve everything I know, and they're taking care of me, and I do give them that space and professional courtesy to tell me what to do, and I'm prepared to follow their instructions.
Yeah, I keep it real. I wish my pharmacist was somebody like yourself who had a transplant also, because you can give somebody the insights on what this medication can do, because you're taking it also, not just coming from somebody outside. Because, when I first got my transplant, my first one was in '93. And you're like Eddie says, I'm the old man. A lot of times, a lot of these medications were brutal. I talk about some medications like right now, like, hey, I'm never taking that medication again because the side effects were vicious. So therefore, I wish I had somebody like yourself who can tell exactly what's going on with the medications from the inside, not from somebody just reading it like, hey, okay, take this, take that. But you having that insight, that's pretty profound. Go ahead, Philip, with the question. I'm sorry.
Okay, this question is for all the panelists, but I'll start with Dr. Richards. What challenges has COVID-19 virus presented to you?
Well, being in dialysis, the moment that it got started, everything changed for us. We started the screenings, lobby days ended, which means we periodically would bring in someone from Piedmont or from Emory or Augusta University to host a lobby day as patients are coming in and out of their treatments, in order to get that extra exposure about transplant, hear it from one more person, be able to ask questions. And all of that has been put completely on hold since that happened. So we've had our hands tied to some extent with how we might handle some educational pieces with lobby days or having outside sources come in. So that's kind of been put on hold. When it initially started, transplant referrals were put on hold. Emory, Piedmont, they weren't doing any unnecessary procedures. And there at the beginning, everything just sort of shut down. So we had people that wanted to be referred at that time that couldn't because there weren't things moving and happening. And then also, I think because of the COVID, it created a little bit of a resistance to some of the referrals. Several people wanted and have even now said they want to wait until things have settled down more before they start doing that. So we've had patients that have had the virus. We had to run separate shifts in order to maintain everything appropriately. But the big thing has been some of those outside resources that we try to connect patients with, we haven't been able to, and then some of the resources that they need to get to, DFACS, Social Security, those have been interrupted as well. So it just, in terms of case management, it has disrupted things across the board for a lot of the dialysis patients. And I think also placed a little extra concern there for the trips to the hospital or for engaging in unnecessary appointments and things like that. So not all of them are affected by that, but some have been overly concerned.
Thank you. Thank you. Mr. Smith, same question.
What challenges that COVID? Yeah.
With me being a new personal trainer, I actually got my certificate while while the quarantine was still going on. So I've been in it as a new trainer, and I feel like if I had done this a year ago, I would have been ahead of the game already, because it's made me jump into more online training than anything. I know there are a lot of people with underlying health conditions, and they may not be able to make it to the gym because they're still scared to potentially get sick again or worsen their situation. Honestly, as a trainer, it's made me think more outside the box as far as how I can help somebody, like I was saying, with their mental and helping them with their nutrition, because I feel like what I've seen a lot is a lot of people have gotten out of shape because of the nutrition portion. They're at home, they have all the snacks. They knew they were going to be at home for a while, or however long they thought they were going to be, and they stocked up on snacks versus proteins and getting the correct calories that they were going to need versus the as I like to call it, dirty bulking in our sport. We like to eat whatever we see. It's called a seafood diet. You see see food, you eat it. And I feel like a lot of people are on that diet. And granted, some people do feel like they're paying for it right now. But one thing I'm doing with clients who feel that way, I'm working with them on, let's just get back to the basics. Let's get the body back active so we can start. Some of them former athletes, so their body's starting to have that muscle memory, so they're kind of getting back into the groove of when they were athletes. So we might start off with some cardio. We might start off with, let's just get the nutrition down. And I've actually seen it. It's starting to become a really good routine. So to sum up everything, I think it's important with everything that we've spoken on is to get into a routine of everything, whether it's your fitness, whether it's your mental health, whether it's your nutrition, or even getting your pills in, or whatever your medicine is that you need to take for these underlying health conditions. It's important to be on routine. And I learned that from Tafaro, because he told me, he knows I had an uncle who passed away a couple years ago. And he was on dialysis. How long? Maybe longer than I was even born.
He was on there for about 15, 20. He was on there 15, 20 close, Paul.
And he was, and he fought hard. He didn't follow anything the doctors were saying, but he fought hard because he didn't want to give up. Yeah. He didn't want to give up at all. And with no routine. But I think it's about having a routine as far as waking up every day with a positive attitude.
That's that discipline piece, man. That's big. I think that discipline and especially, the discipline comes in when COVID, if COVID hits, if you're not a disciplined person in some way, you're going to be sitting around, laying down and eating chips. And you know, you turn around and all of a sudden you got the freshman 15 and you ain't even a freshman no more. So that's huge, you know. So we've seen it happen, and that's big. But go ahead, Philip. I'm sorry.
Oh no, you good. No problem. No problem. No, everything you said is 100% correct. I agree. You know, but I thank you, because the one thing I tell the team all the time is the hard things to start. And so for you to be that person to start with these group of people that you're with currently, to get them back in shape or get them back on the regimen and things like that, I commend you in taking on that role. So we appreciate you. Dr. Ham, the same question for you. What challenges has COVID-19 presented to you?
Yeah, so I'd say we're in a little bit of a unique profession in that we are one of the few that ask you to take your mask off when you enter the building. And, you know, we're generating aerosols in the air. And so we definitely had to kind of take a look at everything in our infection control protocols and really kind of get that ironed down. We were spacing out appointments to make sure that there's enough time between appointments to minimize interactions between patients. We closed off our waiting room. Patients just text us when they arrive, and we bring them back when we're ready for them. And then we were shut down for a while as well. We were just seeing emergencies for a good 3 months there. Really just trying to, you know, only do non-elective care where patients were otherwise going to end up in an emergency room that was already maybe being overwhelmed with this pandemic. So it's definitely kind of been a tough road, and a road with a lot of adjustments, but I think that you know, we're getting there. It's taken time, but we're gradually kind of getting to where things are. I hate to use the term new normal, but I think it's getting to that point where we're at least getting into a rhythm and able to help people that need it again.
Were people kind of nervous going back to the dentist when COVID hit?
They were, yeah. It was, you know, we had a few people request kind of virtual consults and stuff, and we try to be as accommodating as we can. There's only so much we can do virtual, but, you know, at least hearing them out, seeing what's bothering them, maybe prescribing something that can get them by until they're more comfortable coming in. We'd have patients ask if they need to take their mask off, which obviously it makes it a little tough for us to see anything. And so, yeah, it's definitely, but, you know, putting the proper protocols in place to kind of ease their fears. And I'd say once they came in and kind of saw the measures that we were taking, it kind of helped them feel more comfortable, and just the importance of oral health and making sure that, you know, they're not getting to a point where they're having those issues that are bothering them.
I know with COVID, man, if I had a sore tooth, I don't care. Just get rid of this sore tooth. I'll deal with COVID later. A sore tooth will kill you, man.
Yeah, it's nothing worse sometimes than a toothache.
Right. Go ahead, Phil.
Sally, same question. What challenges has COVID-19 virus presented to you, either as a transplant patient or as a pharmacist?
Yeah. COVID affected me, I think, in both ways. When I think in February even, or in March, I got a call from my nephrologist who said that they're faxing a note to my job that I need to work from home before Maryland even went into a lockdown. And I'd never worked from home before. Like, I had clinic days and clinic appointments where I saw patients in person. We had to stop doing that completely. And I used to do home visits for some of my patients that had challenges with transportation. And I would pick up their medications for them, deliver it to their home, update their pill boxes for them. A lot of my patients are elderly, like elderly patients. That's my jam. So I would go into their homes, and if they don't have any support, fill their pill boxes up for them, or if a medication's been stopped, remove those from their pill boxes and update it for them. But since the pandemic, I haven't been able to see anybody in person. All of our interactions are virtual. So it's forced me to develop some coaching skills in teaching my patients how to fill the boxes remotely and telling them this medication, you only want to put it in the middle part. Some of my patients are deaf, all right? They can't hear. So I'm mailing materials to their home, but things that used to take a week to arrive are taking 3 weeks or a month. So it's just forced, like someone mentioned, it's forced innovation, but it's also forced me as a practitioner to think outside the box, because I can't afford for my patients to start showing up in the ER because they're missing their blood thinners, or they don't have a ride to the pharmacy to pick up their blood thinners, or they don't have a ride to the pharmacy to pick up their anti-rejection meds. So really working with the hospital to start a delivery system for the patients that I couldn't see, and we're doing non-contact deliveries for those patients and their medication. As a patient, I was waiting for a transplant. So when they said no elective procedure, I legit cried for days, because I knew I was getting my labs every 30 days. So I knew that I was really, really close. And so to hear that procedures are being suspended, I knew that that included transplant, and that was devastating for me and my family, because we were excited that I was getting close. So in November, when we got the call, Georgetown let us know that they were resuming, and then November, I got the call. So my surgery, my husband couldn't be there, my sister couldn't be there. I have a huge family. I've never had a surgical procedure where the waiting room wasn't filled with like 20 people between my friends and my family. And here I was waiting in the ER and waiting to go to surgery by myself, like, and then in the hospital for 4 days by myself without my family. And that was really, really hard. And it gave me like a changed things, and virtual appointments where, you know, I used to go in person for 15 years, but now everything is virtual, but semi-normal. But yeah, that's pretty much how it's like affected me as a patient and a practitioner.
Yeah, that's big right there, because I can only imagine coming out of a transplant and, you know, no one being there. You know, I remember, you know, coming on my transplant, and I had, you know, I was at Johns Hopkins when I got my second transplant. And I remember people, you know, being there and supporting you and everything. You got 4 days of nobody there. That's I didn't even, you know, consider that till you said that right now. That's big. That's, whoa, that you were your own support system, and that's huge.
Yeah.
Wow.
And it was hard. Like, it was, I don't know, that I realized how, I think I took that for granted, because there were always people there if I'm in the hospital. And now there was nobody there, and we FaceTime, but they go to sleep and I'm souped up off prednisone. I'm wide awake at night. I can't sleep. So yeah, it was very challenging, and it just gave me a lot of respect for people that are currently being hospitalized with limited access to their families. But it was one of those things that I just think nobody talked to us about, and we just found ourselves there. And I wasn't going to say no to a kidney because I need my sister and my husband there.
Right.
Last question. This is for all the panelists as well. Is how can we, as YNOTT, better connect our patients that we see to the resources that you all provide?
Go ahead, Dr. Phillips, on that question. Let's start with you,
Yeah,
Dr.
I'm sorry.
Phillips.
I apologize. Yes, Dr. Phillips, go ahead.
You're fine.
that one's kind of a tough one for me in dialysis because we don't really provide resources. We provide the service of dialysis just if people need it. I will say that within dialysis, once we are connected, there are different resources we connect people to. The kidney fund, I'm sure you guys are aware of, that's not just obligated to us in dialysis, and the National Kidney Foundation, which in the earlier panel, someone was affiliated with that. That's a big resource. Here in Georgia, we have the Georgia Transplant Foundation, which will help with things like getting your dental work taken care of and stuff if you're working towards getting a transplant. So there may be different resources I'm aware of I would connect patients to, but we ourselves don't necessarily aren't a resource. I would say, and this is sort of a side note, that I think one of the most beneficial things that you guys in YNOTT, and I think also there are still some maybe family members here, the more you guys can learn and understand about trauma and being trauma informed, I think is going to greatly change your interactions with people. And it's really critical to know that some of these developmental encounters, medical procedures early on, I mean, that can be medical trauma. The fear of losing your life, that's trauma. So we think of trauma sometimes with a big T, and there are a lot of little t traumas that accumulate and can become a big T over time and complex. So I know that wasn't resource related, but I wanted to put that out there because I do think that that would greatly shift how interactions across the board happen, being trauma informed. Not that you guys aren't, but just to continue to develop that.
No, we
Dr. Phillips,
that work. Oh, go ahead, Jafar.
Dr. Phillips, that's really important because the small traumas can equate to big traumas eventually, especially when your mind is going through these things over and over and over. And that's how these small traumas become large traumas. And that's very, very important on what you said right there. That's why I had to convey on what you said on it. That's very, very big. Go ahead, Philip. Go ahead, Philip. Philip?
Can you hear me?
Yeah, we can hear you now. Go ahead.
No, Dr. Phillips, no, everything you said is very important, especially when you haven't gone through something as traumatic as some of us have with transplant or just life-threatening illnesses in general. And those words will do us a lot of justice because we may have somebody come through YNOTT that wants to be a part that have not gone through what we've gone through. I mean, most of us have had transplants, or family that, that have gone through these situations. So definitely to be able to go back and show this later, maybe to somebody who has not gone through something that we've gone through and to get those words will definitely help them to understand kind of exactly why we do what we do and what these pediatric patients are going through. And Mr. Smith, same question. How can we as YNOTT better connect our patients to you or your services that you provide?
You can directly send people to my website. I actually, now that I've had time to listen to what everyone was talking about, I want to do some more research into this. I think right now with what I offer, I think it would be best for anybody who does come with me to, we can work on nutrition and things like that. Cause like I said, I'm huge on that now. And I think that would be something that can be regimented in somebody's everyday life. So yeah, just I have a website. I'm going to leave it in the chat real quick. And then you can always follow me on Instagram, J_Smith I. And I can always have conversations with you about what you could better do with your nutrition and just your lifestyle in general. I take time out of the day to do it every day, and I enjoy doing it. And if I can't find the resource, I will definitely find someone who can do it. The networking in this world right now is crazy, and if you're not using it, you're doing yourself a disservice.
Yeah, and I can hook people up with James also. That's my man right there, and he is, like I said, I wouldn't ask him to be on here if he wasn't such a great dude, man. So if anybody, you know, knows me and wants to get connected with James as far as fitness and nutrition, I'll definitely give you his information. Go ahead, Philip.
Sally, same questions. How can we as an organization, I guess, support our patients and you know, sending them to you, whether it's just you know, question and answer time or just getting information in general, anything like that?
I'm currently trying to work on developing like an online webinar to show people how to navigate needymeds.com and focusing it very specifically on transplant patients. And so I know that like YNOTT was one of the organizations that I am definitely considering to see if that would be a partnership that they're interested in. But as a pharmacist, like a lot of people do inbox me to ask me about choices like between their cholesterol medicine, like is this one better than that, or I had an allergy to this medication, would I still be able to take that? So people do ask me a lot of general medication related advice, but I'm really trying to focus more on medication access and helping people know the different things that they can do, that they can advocate for to get more access to their medication, especially if those financial or socioeconomic issues are in the way that are making it difficult for you to take care of yourself and do what you need to do to be the healthiest you can possibly be. That's really like what my passion is about, because I don't want anybody not taking their medication because of cost or because they can't get to the pharmacy and things like that. I do have an organization that is brand new, like I'm just starting out, and it's called Sally's Journey, and I am on Instagram that way. But if anybody's interested in connecting, I will drop that handle in the chat. But absolutely connect with me, and I love what YNOTT is doing, and especially the focus on pediatric, being that I was diagnosed at 15, and a lot of everything that I have been through, it's because of the bad habits I had as a teenager. They went with me into adulthood. So every time I have a chance to collaborate with YNOTT, I never give up on it. I always want to, because I know their target audience, I can relate to them because I legit lived it. So, but that would be all for me, I think.
Medication access, like I think that's big. I have to chime in on this because, again, you know, we see this all the time as being one of the barriers of people not getting any type of transplant, because that's one thing. Yeah, we see this, and people hold on to this barrier like this is why. And so if we can break that barrier and get people their medications, you know, we'll be a long way down the road with people getting transplants. So thank you for that. Appreciate that.
Absolutely.
Thank you, Sally, for joining us. I believe, Dr. Hamdi, I did not ask you that question, correct?
No, you didn't. Go ahead.
No, not yet. Yeah.
Same question for you would be, how can we better assist our patients to connect with you and your services as well?
Yeah, I think, you know, first of all, I think you guys are doing a great job already. I mean, this seminar has been phenomenal, and I've already pulled a bunch of things that are going to help me interact with my patients, especially my immunocompromised patients. I'm happy to help in any way I can. I don't know how many people are local to the DMV, but I'll drop my website as well in the link. I can also leave you guys my personal email if anybody just has a question about dentistry and how it interacts. I'm happy to answer. But I think spreading awareness through events like this just exponentially kind of branches out after events like this, and it's a great way to kind of get the word out and the way it was structured as far as professionals, families, it's been really insightful.
We appreciate those words. Thank you very much. Mr. Cook, did you have anything you wanted to add?
I just want to add this, and then we can give it to the host. Thank you, everybody, for this panel. This was informational. I was informed on a lot of great information from all sides, and it was wonderful. I appreciate all you guys getting on this panel and sharing your knowledge. And why not?
Yes.
No,
yes.
awesome. Go ahead, Philip.
Real quick, Mr. YNOTT, I appreciate you. And like I said, everybody on this panel, we appreciate coming and giving the information that you gave was also in the family support panel as well. All the information that we were able to gather here today will definitely be used to be able to better ourselves, our patients, our families, connect them with wonderful people like yourselves, and you with them as well. So definitely hope that we can have you again sometime at whichever type of event that we have in the near future. And we definitely hope that you have a great evening. Edward, go ahead, take it away, mister.
No, awesome. I know a lot of people on mute, so let's get them a quiet round of applause, man. This was awesome. Just like I knew it would be. I want to thank each of you for hopping on. I know it's late on the East Coast, so thank you so much. And also thank you, Dr. Hamdi out in Baltimore. He's also a sponsor, so you can see his logo, Mint Dental Care. He actually gave me did something to my my tooth, gave me an implant about like 6 months ago. So he's the guy to go to if you're in the DMV area. I would like to thank all the panelists for today. It felt like I went to church or went to inspirational support group and when I got my MBA, listening to you all. So I mean, this is awesome. This is awesome. And I would like to once again give our sponsors some recognitions, CareDX, Cedars-Sinai, Nationwide Children's, Mint Dental, Cars East up in Ohio, and there's so many others. This would not be possible without you. Like I said, it's crazy. Briefly, a couple of days ago, we did a walkthrough, and I was like, man, I almost gave up. We did a walkthrough, almost gave up. I'm like, oh my God, we ain't
Our
going.
walkthrough was trash. Okay, our walkthrough was trash.
It was horrible. As a former student athlete, if we would have performed like that a day before the game, the coach would have been, we would have been running suicide or something. But we prayed, literally, before we got on this, we prayed, and I said, we're in this thing. See I got an alarm somewhere in my hotel room going off. That means it's time to shut up and be quiet, should I say. But yeah, we prayed before we got on here and gave it to the Lord, and he allowed us to be inspiration. Once again, we never claim to try to be the biggest. We just try to be the most inspirational and do what the Lord called us to do. So and impact lives. So once again, thank you all so much. This is only the beginning of day one. Tomorrow we'll have some more amazing panelists from across the country. And we'll also be interviewing patients, and we'll be revealing something special at the end. I'm so excited. This is 10 years coming. We launched it back in 2010, and since then we went and got the copyright trademark. Like I said, we went to got our MBA, got smarter, got wiser on a business end, and we look forward to it. So once again, thank you all so much. I mean it from the bottom of my heart. Salute, continue to do great things, and God bless y'all, and I'll see y'all tomorrow. Take care. Why not? Have a great night.
Why not?
Why not?
Why not?
Thank you.
Oh yeah, last thank you to the lady. Thank you to Lily behind the scenes, engineering this thing.
Yeah, Lily, you did the thing. Thank you, and thank you for all the parents too.
Yeah, she engineered our dreams to fruition. Thank you. That's it.
Yeah, she did.
Take care. Okay, thank you.
I also want to throw a very quick shout out to Dr. Phillips for being on here from UGA. He and I connected at UGA, and I really commend him for what he's doing, and just wanted to send him a very special personal thank you, just from a student to a professor. It really means a lot that you're on here and you're supporting what we're doing. So thank you for that.
Yes, sir. Thank you,
Dr. Phillips.
Thank you. All right, cut us off, Lily. We could be on here thanking everybody. We're so grateful. Thank you. Cut us off, Lily.